how very little can be done under the spirit of fear. This is a quote from Florence Nightingale. Florence Nightingale is known as the founder of modern nursing. She is also known for her advancements of hygiene and cleanliness in the nursing field and throughout hospitals worldwide. Florence Nightingale was born May 12, 1820, to a wealthy upper-class family in Britain. But in 1844, she told her family that she received a call from God and that she needed to go in the nursing field. It was unacceptable at that time for a wealthy person to be in the working class. And they say a woman's job should be a wife and a mother and not a nurse. But Florence disagreed with all this and became a nurse anyway. Upon entering the nursing field, Florence tended to soldiers in the Crimean War. She talked of how soldiers were dying from lack of hygiene and lack of wound care. Medicine was in short supply, wound care non-existent, and the death rate was 42% from infection. Nightingale improved hygiene best she could, and if she couldn't better something, she called the Sanitary Commission. By doing these things, she reduced the death rate from 42% to 2%. She once said, "I think one's feelings waste themselves in words. They ought all be distilled into actions which bring results." Nightingale was named the Lady with the Lamp because she would go around at night and check on her patients to make sure they were comfortable. She was an advocate for an improvement in health care of the patients and better conditions in the hospital. The very first requirement in a hospital is that it should do the sick no harm. This is a quote from one of her most popular books, named Notes on Hospitals. This book gave hospital statistics on sanitary techniques and how much these techniques brought down the risk for patient-related infection and death by infection. Nightingale opened a nursing school of her own in 1860. Named the Nightingale School of Nurses, and wanted to train nurses to teach, work with the poor, and work in the hospitals. Working with the poor included going to patients' houses to provide care. That's something that's still done today. Florence Nightingale passed away August 13th of 1910 at age 90 in London, England. Florence Nightingale changed the way nurses nurse. She taught nurses how day-to-day importance of hygiene, compassion, and commitment are to the nursing profession. This has left a lasting legacy and contribution to nursing. Nightingale became known as the founder of modern nursing from these things. Leistra Greder wrote a pledge as a token to Nightingale and is recited by nursing graduates all around the world. I said this pledge myself May 14, 2011. The Florence Nightingale Pledge. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and I will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to the aid of the physician and his work, and devote myself to the welfare of those committed to my care. Thank you.